Hi, Miriam.
Hi, Freddie. Nice to see you.
Correct me if I'm wrong, but I think of you as part of a group of Tory MPs that are sort of concerned about bigger values than the economy and are keen to kind of restate those. And I think this has been a really interesting question on that the last 12 months. How do we balance different values in our society? Um, and in a way, that group has been tested here because, in a sense, there's a sort of national community spirit all coming together, saving lives ethic around lockdowns. But then, as you say, things like relationships, families, education, the core kind of social fabric of our society is basically being decimated by this. Have you found it hard to navigate that kind of moral conundrum?
Yes, that's a very good question. Yes, I have. And I think the reason for that is that over recent years, we've almost stopped talking about morality in public life. And actually, this crisis has exposed that we are very much still a deeply moral nation, because the concept of all of us sacrificing to save the lives of others is actually a very moral concept. Where I think the difficulty has arisen is that we have, as a society, and this isn't a political point, but a cultural point, we've become very almost obsessed with what we can measure. So we can measure the length of people's lives. We can measure the number of people that die. Can we measure people's sense of fulfillment? No, that's much more difficult. But is it important? Yes, it is. Why do we live? It's not just to avoid death. We live for all sorts of reasons, and a lot of those are relational. There are relationships with our family, our friends, our work colleagues. And there are lots of studies to show the impacts of loneliness and social isolation. So yes, this crisis has thrown all those things, up in the air, really. And I think some people have tried to make a division between health, the economy, and which is it more important to save. I think that's almost a false division. The real division is how much long-term harm are we willing to do for short-term gain. And there's no right answer to that question. We have to take decisions now to save lives now that we know will cause harm in the future. And that's the balance that we're looking at. And that's the case with schools. If we close schools now, we may reduce community transmission. We may reduce the number of people who end up in hospital and die. That's a good thing to stop that happening. But we know that we'll cause long-term harm to our children. Now, where's the balance in that? There's no scientific answer to that. That's a moral answer. I think those are the kind of questions that we need to be asking going forward. And again, in school life, we've become obsessed with measuring outcomes in terms of GCSE and A-level results. But actually, schools provide way more than that. They prepare our children to build, grow, and maintain relationships for the rest of their life, to be resilient, all those things that you can't get a job without those skills. You can't have a successful family life without those skills. And that's what we should be looking at in terms of how do we rebuild our children's lives? Not just how do we make sure they pass GCSE maths, but how do we restore their confidence? How do we re-engage them? How do we build resilience? How do we address this situation where I think there was a study last week that showed 1 in 6 teenagers now have a mental health problem. I mean, the waiting lists for children's mental health services were already very, very long before this crisis. Now they're going to be huge. How are we going to address that? So I think, yes, that this is a crisis that needs a moral direction as well as a scientific one.
Are you worried that, in a way, we're going towards a kind of scientism or a kind of worship of science in the place where religion used to be? It feels like the media conversation is so dominated by scientists and the kind of respect the science motto. But as you say, kind of moral voices are much less highly prioritized because they don't have those charts, they don't have those statistics, which just make such neat and powerful arguments. Who should we be hearing from more? How do we redress that?
Yes, I am concerned about that. And I say that as a scientist. I have a strong belief in science and evidence, and that we should use it as a tool. But I think I would say 2 things to that. Firstly, there's nothing wrong with being guided by science. How do we present that science? And are we looking at all pieces of evidence? That's the question. So I think the media have become obsessed with the things that we can measure, like I've said, and this idea of following the science. Well, epidemiology is not the only science. Behavioral science, psychology, all those things are mixed into our understanding of how to tackle COVID. So the Prime Minister said way back last March that lockdown is a limited measure because people will become frustrated with it, and that will have its own impact. And that's behavioural science. That's just as important in understanding how we deal with this crisis as epidemiology. And the media, unfortunately, never put the science in context. So they talk about, let's say, number of deaths, but not number of excess deaths. Or they talk about how many people are making car journeys, but not how many people normally make car journeys. And in science, you never take data out of context. And yet that's what's being done. So I think there's a way with how a problem with how science is being presented. But yes, I do think we need to reassert the importance of moral and political leadership, that science is a tool that's there to help us. But some of these questions of life, science can't answer. So yes, I do think we need to return to those kind of ideas.
And of course, one institution that historically was providing moral leadership was the church. In previous pandemics, the church has played a huge role, and it's been amazingly absent in this pandemic. I mean, it literally shut its doors, and you could say that the kind of church leadership sounds more like a kind of public health professionals talking about the importance of wearing masks and taking vaccines. There's been very little from the Church of England, anyway, about the moral issues concerning this. What do you think about that?
This has been a challenge for the church, this crisis, because in a normal, well, there's no such thing as a normal crisis, but how the church would want to respond in a crisis is to wrap its arms around people and to provide the physical help that people need. And obviously they've been prevented by law in many cases from doing that. But I do think we need to separate what local churches have done, which has been phenomenal in terms of organising volunteers. A lot of church members are obviously vulnerable themselves, but they've been phoning around people, checking that they're not lonely and things like that. So I think it's amazing work being done on the ground. But I have to agree, and I'm saddened by the kind of national institutionalised church response, which has more often been to criticise government policy than to make the case for a spiritual awakening. And and as a committed Christian myself, I find that sad. And I think, we've still got to discover how will this impact religion going forward? Because I would want it to see people start to ask those questions, those deep questions again. But I don't think we've got to that point yet.
Do you think the churches should have closed? It's the first time that the churches in this country have actually shut its doors, apparently since the 12th century or something. Tom Holland was telling us.
Well, I think it's important to say that since the end of the first lockdown, they have been open and they haven't had to close again this time. I mean, church is not normal, wearing masks, no singing, that kind of thing. But I don't know. Was it a mistake? I think had we not had Zoom and those other ways of connecting, then perhaps it would have been. But it was a moment of crisis, and I can see why that decision was taken. But I am pleased that they haven't been shut again, and I think that's how it should stay.
Do you think, we talked about sort of scientism, in a sense, it is a new church slightly, isn't it? Because, I don't know if you spend a lot of time on social media, hopefully for your own mental health you don't, but those of us who do, questions asked of the scientific consensus are treated these days a little bit like heresy. And actually they are now policed by sort of inquisitors almost. Have you noticed that? I mean, is that something we should be worried about? That it's actually, the science is having a slightly sort of early church-like atmosphere.
Well, I don't spend too much time on social media for those reasons. But yes, I think across social media, whether it's science or other issues, there has been common intolerance and a fear of challenging the status quo. I would agree with that. But I go back to my earlier point, really. I think there's nothing wrong with following science as long as we make sure we're asking all the right questions. And we absolutely should be asking questions. I mean, any teacher of science, the first thing you want your students to do is ask the right questions and to challenge what they see. So we should, yes, it is dangerous to get to the position where science isn't being challenged. It absolutely should be. And this coronavirus has been a challenge to the scientific community, and we've seen changes in evidence, in accepted wisdom as we've gone through just in the last year. So we'll certainly see more changes in the years to come. So yes, it is that dangerous if the science isn't challenged. But I think it's more about making sure we hear lots of scientific voices rather than just accepting one or two.
It's been such a kind of technology-enabled year this past 12 months, hasn't it? School is now happening remotely, and in a way that's been helpful because it enables people to still be connected in some way. But you could argue that we would never have even been able to lock down were it not for that technology. So there's a sort of accompanying danger there, isn't it? That one long-term effect of all this could be that we fundamentally change the way we associate and start getting used to just staring into screens and seeing virtual versions of people instead of actually physically being together. Are you worried about that?
Yes, I am worried. And you're right. If we hadn't had the internet, we wouldn't have been able to lock down, because who could work from home without the internet? There are advantages to it. I certainly don't miss lots of evening meetings. But yes, I am worried, because it is not the same as meeting real human beings and forming relationships. I'm particularly concerned for our young people. And a teacher was joking to me the other day, is this the end of snow days? Because there's no reason to not learn now just because it's snowing and you can't get into school. So yes, I am worried about it, but I think it'll be interesting to see people's attitude as we come out of this, because had July seen the end of this crisis and that first lockdown been it, I think people would have been very accepting that home working is the way forward and those kind of things. But I think it's moved on so much. People are so lonely now, are so dissatisfied with constant screen time, that I think there'll be a strong move back towards physical interaction, because people have just missed it so much.
Well, I hope you're right.
Yes.
Do you think that your constituency up there by Sheffield is called, well, it's part of what people call the Red Wall? This is a group of northern constituencies that were historically Labour and then fell to the Conservatives in 2019, and you were one of those. How do you feel like this pandemic has affected the politics around that group of constituencies and the so-called Red Wall Tories? Do you feel like it's challenged the relationship with the centre, or has it sort of brought them on even more strongly?
People are generally very supportive of the government's position, in that they've had to make some very difficult decisions. And I think whilst people obviously don't like lockdown, they accept the need for it. So I think people are understanding of our position. I think that the challenge will come in how we rebuild. And whilst
I guess I mean, just to clarify, just to sort of explain what I meant, I guess I mean constituencies with lower income, constituents, not part of the kind of affluent southeastern belt. They've been particularly badly affected by COVID, but they've also been particularly badly affected by lockdowns and the whole new sort of regime. So I'm just wondering, what do you hear from your constituents about that? What's the mood around this so-called new normal?
Well, in terms of the casework I receive, I mean, a lot of it is about people concerned about their children's well-being long term, and people who are struggling to manage without schools. So I think, returning to our earlier discussion, getting schools back is absolutely crucial for those people. But in terms of people whose incomes have been affected, at the moment, the government support schemes, despite what's often reported, are going down very well. They really are providing the support that many people need. So I think, again, the challenge will come when we start to reopen the economy, when the full extent of unemployment becomes clear. That's when the challenge will come. But I've also got quite a lot of elderly people in my constituency. And so, the challenge for them has been around loneliness, but also getting support they need. But actually, the voluntary sector and the community sector has stepped up so well to those things. But I haven't been able to get out and about much, as all MPs. But in terms of my casework, I think that predominantly the concerns are from the very young and the very old, and they're more focused around social issues rather than the economic support at the moment.
So, final thought for you, Miriam. Big picture, it looks to us like there are two separate sort of end states here. There are two separate strategies. One is to just wait for the case level to come down to an acceptable level and rapidly start to reopen, and keep an eye on the health service as the only metric that would ever push us back into restrictions. And then there's another idea, which is increasingly popular, I would say, which is the so-called zero COVID idea, where we essentially keep the borders closed in the longer term and attempt to totally eliminate the virus inside our borders by driving it down and down and down with longer term restrictions. The argument is that will then gain us more freedom thereafter. Do you have a view on that? Which of those routes you'd like us to go?
I would think it's dangerous to pursue a zero COVID strategy, because as dangerous as COVID is, and as much havoc it is wreaked on our life, wrought on our lives and economy, it is a virus like many other viruses, and we do live with infectious diseases. Government can't prevent all death, and I think in normal times most people accept that. But there are dangers from variants that could not be suppressed by the vaccine. So I think that's the biggest worry at the moment. We get to a point where we've got it under control in the UK, and then a new variant comes across the border that requires an entirely new vaccination program and an entirely new lockdown. I mean, that would be a disaster. So I think I don't think we should pursue a zero COVID strategy. I think we should have a sensible attitude to risk. But it's too early to call that for the next few months, from my position, because until we've seen the actual effect of the vaccine and how much it does reduce hospital admissions and deaths, which hopefully it's going to be very successful, then I think it's very difficult to make that call. However, what I think we should be moving to in the long term is, if we do see that coronavirus regularly mutates in the way that flu does, we just build it into our yearly vaccination programme. So we have the vaccination programme, but no restrictions long term. That would be what I'm hoping for. I mean, this crisis has thrown up all sorts of questions about people's attitude to death and life expectancy. And I think in normal times, people have been accepting that, people die and that we have a good life expectancy in this country generally. But the overwhelming nature of this crisis has thrown that into question, and I think it will be interesting to see how we come out of it. But I certainly think we should have a return to our previous understanding that, yes, the NHS should be there to help prevent death and to restrict diseases, but that we also need to take a kind of balanced attitude to those risks.
So we're going to get the old normal back then, Miriam?
I think we need to get the old normal back, but with some more discussion about what life means and what makes our lives fulfilling, and to start talking about the things that perhaps can't be measured.